Welcome to Wellness Wednesdays. This is a new special summer series that's produced by the Society for Integrative Oncology. My name is Lee Leibel, and I'm delighted to be your host today, as well as your host during this 15-part series this summer. This is our second episode, and the topic is yoga and cancer. The purpose of these Wellness Wednesdays, which are released there's a video component which is released every Wednesday and a live panel like we're doing today. The purpose is to show you the depth, breadth, and diversity of mind-body practices from all different traditions and disciplines that are evidence-based or evidence-informed that can help us to cultivate resilience and compassion, and also help us manage stress and distress during uncertain and challenging times. So these are tools that you can use to help navigate the waters today and with global events. So I am thrilled to have my three colleagues here with me today. Yoga is a wonderful topic and one of my favorites. I am the chair of the Yoga Special Interest Group for the Society for Integrative Oncology. And I also have a mind-body practice at Columbia University Medical Center in New York, where I work with cancer patients across the care continuum from diagnosis to end of life, helping to develop programs to help manage their symptoms from treatment and improve quality of life, and hopefully to also positively impact their clinical outcome. So today, with no further ado, let's jump in and meet our three rock stars who are leading voices in the yoga and supportive care community. We're all friends and colleagues, so we've decided to use first names for this webinar. And we're all members of the Yoga Special Interest Group, and we're all certified yoga therapists. So just want to give a big shout out to IAYT, the International Association of Yoga Therapists, for their advocacy on behalf of yoga therapists around the country and around the world. So let me start. I'll just go alphabetically. So Smita Malaya. Smita is a senior mind-body intervention specialist at the University of Texas MD Anderson Cancer Center in Houston. She has a Master's of Science degree in yoga from SVS University in Bangalore, India. And she's involved in research at MD Anderson across many different cancer populations. And she's also involved in clinical care at MD Anderson, working both inpatient and outpatient. So welcome, Smita.
Thank you, Lee.
Yeah, so Robin Tiger. Robin is a physician, and she trained in radiology, and she's the founder of Yoga Heals for Life. And she works with and serves on behalf of cancer patients and people who are affected by anxiety and stress disorder. She's been involved in some exciting research projects with yoga and peripheral neuropathy, which is chemotherapy-induced or treatment-induced peripheral neuropathy. And she's also an advisor for the journal Yoga Therapy Today, and she's on the faculty of trauma-informed yoga therapy. Welcome, Robin. And I do hope that you'll tell us a little bit about your journey from being the medical doctor and treating women in clinic to the transition into holistic care with yoga therapy. It's a really fascinating story. Tari Prinster. Tari is really the trailblazer here with yoga and supportive cancer care. She's a 20-year cancer survivor herself, breast cancer survivor, and she's the founder of Yoga for Cancer. And if you can believe this, she has trained more than 3,000 yoga teachers in this methodology for yoga and safe practice with cancer patients. She also is the author of a best-selling book on yoga and cancer. It's called Yoga for Cancer. And let me see if I can get the whole title right. Managing side effects, boosting immunity, and improving recovery among cancer survivors.
Yeah, very
Okay.
good.
Okay, so welcome everyone. So I just want to give our participants, whoever's joined us, just a look at how we're going to manage our time today. So I think we'll go for about 45 minutes. However, I know this is your lunch hour and we do honor your time. So please, anytime that you need to hop off, please do so. This is being recorded, so you'll have the chance to see the entire program, even if you can't stay with us till the end. This is interactive, so this is super important. We want to hear from you, and we want to answer your questions. Use the chat function, and I'll keep an eye, and we'll read out the questions as they come. So when we were all brainstorming the other day on what we wanted to present today, we said, what is the biggest side effect of treatment for all cancer patients, no matter what kind of cancer you have or what stage in the continuum you are? And it's fatigue. Fatigue is a really big problem. And we don't know the etiology of fatigue, but we do know that it appears with clusters of symptoms, things like depression and anxiety and trouble sleeping. And we know that yoga, of course, is elegantly poised to help address all of these different multifactored symptoms that may arise. So when we think about fatigue, and I just want to make sure that everyone knows that the National Comprehensive Cancer, NCCN, National Comprehensive Cancer Network, in their cancer-related fatigue guidelines, gives yoga a Category 1 recommendation for a non-pharmacologic tool to help manage fatigue. So that's huge, whether you're a clinician watching this right now, or whether you're a cancer patient or a therapist, just know that there is high level of evidence that supports the use of yoga to help fight fatigue, among many other side effects as well. So when we thought about the physical practice of yoga, because we know that exercise is so helpful also to combat fatigue, we said, what are the two big risk factors that we need to watch for when we're working with a cancer population that's doing that's doing an asana practice, if you will? We said, of course, lymphedema, and of course, osteoporosis. So today we're just going to look at these two physical aspects of practice. Next week, we're going to get into the psychological component of yoga and cancer care, looking at working in the infusion center and inpatient at the bedside. So since we only have this short period of time, we're going to focus on the lymphedema and the osteoporosis. I just want to have a conversation. I'm going to open it up and just ask the three of you, in your practices with cancer patients, what are some of the things you see and some of the issues around feeling fatigue and wanting to be more active, and particularly wanting to be part of a community, a group working together in a class for that community support?
Well, I'll jump in here and start off, just for the lack of knowing where to start, and
Sure.
say that back in the day when we were doing in-person yoga,
Yeah.
and people, survivors and patients would come to my yoga classes that were designed to serve those in treatment as well as those having completed treatment. And so it wouldn't be unusual for someone to walk into the class and say, I just had, a treatment this morning and I'm not feeling quite, I don't know what I can do, but I want to be here. And that to me was like the first step to know that, what this person already knew about themselves, that they just had a treatment. It can possibly cause fatigue. And they may not be able to perform up to what they did last week. So I would just encourage them to being there, because they are obviously there to do yoga, and say, come in, sit down, take a comfortable position and just be with us. And before long, I would find that they were right in there with everybody else doing the yoga. So even though someone might feel fatigue and have that tiredness that comes from, not necessarily the tiredness that you get after working all day long or having planted your garden for the whole weekend, but a tiredness that comes with from treatments, which is a very different kind of fatigue and a very different kind of tiredness. You don't know when it's going to come on, and it affects everybody differently. So what is encouraging to me is that people understand this about themselves. And it may be, as you say, Lee, clustered with other kinds of components, like they didn't eat a proper lunch.
Mm-hmm.
But in the commitment to doing something, which is what the American Cancer Society is telling us, and they're putting it at a level 1 form of exercise. What are the 2 things you want to do to modify, manage your cancer side effects? Exercise and eating right.
Mm-hmm.
So I think that that's where it falls into, fatigue, and the amount of research that has been done on fatigue as a evidence-based practice, that measuring control group against those who are doing yoga, it has shown that definitely it is a measurable thing, that the yoga can actually reverse the fatigue, the self-identified feeling of fatigue, whatever its causal.
Yeah. That you made a great point, Tari, that you have to look at the whole picture of good health, and that includes your nutritional, your diet and your nutritional support, and your exercise, your movement, having a good night's sleep. I just want to read quickly the official version of, or the definition of, cancer-related fatigue, and this comes from the NCCN, again, which is the National Comprehensive Cancer Network. And this really just supports that it's a fatigue that is quite different from just an ordinary fatigue or a flu type fatigue. So it says cancer-related fatigue is distressing, persistent, subjective sense of physical, emotional, and or cognitive tiredness, exhaustion related to cancer and cancer treatment that is not proportional to recent activity and interferes with your usual functioning. There's an interesting story about the 3 spoons that a lot of cancer patients talk about. And the idea is that you're given, every morning you wake up and you're given 3 spoons. And for every activity you have to do for the day, that is 1 spoon. So it might be you have to go and do your grocery shopping, and that's 1 spoon. It may be that you're going to do your yoga class, and that's another spoon. And then you have 1 left, and you might just have enough energy left to either go for lunch with a friend or to have a dinner and sit with the family. So the point being that you really have to you have to be gentle with yourself and understand that this is a different kind of fatigue and you can't do everything.
If I'm not jumping from the line of thought, something else that I have seen continuously with patients is when they do experience fatigue, they don't necessarily think of maybe fatigue as a side effect that can be easily tackled.
Mm-hmm.
If they have another symptom, oh, I'm having maybe constipation or nausea, it is something that is treatable directly and that can be addressed. And maybe fatigue is not something that patients and family caregivers perceive as something that can be addressed, and maybe they feel better. And whenever they think or hear of maybe the recommendation of sometimes even exercise, they do probably assume that is far-fetched from how they feel and where they are headed in the notion of exercising. So I do think the beauty of and simplicity of yoga practices is that you don't necessarily have to have so much energy and be in a shape to begin the practice. And with so many tools of yoga therapy, bringing in even a simple breath practice, and that's why I said, I hope I'm not jumping the gun into the practices of yoga therapy, but the simplicity could be a simple breath can help ground, a simple movement or a practice can really bring the patient not only to connect to themselves of how they feel in the present moment, but also in turn bring in great and far benefits, as my colleagues, all of you have worked and seen that as well.
Sure.
I think that Tari teaches our bodies are made to move. It's something that she taught me a long time ago. And just piggybacking on what they're saying is that time and time again, I have seen patients, clients, students come into class exhausted. It was so much just for them to get there. At the end of class, they're energized and feel so much better. And in thinking about lymphedema, I'm remembering that the lymph in our body doesn't move by itself. It's unlike the blood in our body that gets pumped by our heart. The lymph moves when we move, whether it be with our muscles contracting and relaxing, whether it be with our diaphragm pumping a very important duct in our belly. And when we move the lymph, and the lymph nourishes us. In addition to cleansing, it gives our cells nourishment. So when we move, we nourish ourselves and we feel better. So it really helps even the smallest amount of movement or breath to nourish ourselves to feel more energized no matter how much fatigue, just by the simplest of movements. So.
And to follow up on what Smita said about the idea of breathing, we know clinically it is evident that many forms of cancer treatment, particularly chemotherapy, can lower our red cell count, which is depriving us of oxygen. So introducing the idea of a consciously breathing as an exercise, and we're talking about exercise here as a solution for fatigue, but breathing as an exercise to rhythmically, mindfully move and release oxygen for the body is a very good beginning point to introduce the yoga. And I know for myself, as when I was a patient, the idea of exercise was, counterindicated. Yeah. You need to go home and rest and not move. And it's just as Robin is saying and Smita is saying, it's actually, whether it's breath movement or physical movement, that is where we are going to find the solutions to fatigue.
Yeah, it's so important to remember that diaphragmatic breathing does help move the lymph through the body. And I think what a lot of people don't know is that lymphedema is not just something that you can get in the upper body, in the arms. It can also appear in different parts of the body if you have had either radiation to lymph nodes or you've had node dissection. pelvic area, head and neck cancers. You could get it in your neck. You can get it in the abdomen. Gynecological cancers. You can have lower leg lymphedema. Breast cancer is the most studied cancer as it relates to lymphedema. So I think it's important to emphasize that the breath is, no matter what kind of cancer you have, the breath is really important to get that lymph moving.
And most of the stressful breathing is happening up here, right? So a really important piece of our yoga therapy practice is to teach individuals to breathe lower into their bellies, to get that diaphragm moving down, to pump that thoracic duct and get the lymph moving through the body. So decreasing the stress response by simply teaching the breath and the location of the breath lower in the body will help that issue with the lymph as well.
So there are lots of questions about what kind, when we speak about exercise, what kinds of exercise to do. And, there are many different types. And I think when it relates to lymphedema, one of the most shocking discoveries that I made many years ago now, which has been continued to be on the scale of looked at and studied with very concrete evidence showing that lymphedema is not caused by weight bearing. It's probably one of the most common misconceptions about the causes of lymphedema and what would be counterindicated. And weight bearing exercises are definitely there's no indication that they cause the lymphedema. And in fact, there's great research, many studies that show that it actually can have a reversal effect that can help manage the lymphedema. I'm not saying cure, not saying a treatment for, but definitely manage. And yoga is weight bearing. And we kind of miss that point about yoga as a form of exercise where you are bearing the weight of your body and not just on your upper torso where the most frequent occurrences of lymphedema might be in effect, but your lower torso, so lower torso lymphedema and the weight bearing that happens there. And it goes back to movement, which is movement of the muscles, movement of oxygen to those muscles, and also the tertiary effect of moving lymph. So exercise as a solution to both fatigue and lymphedema is really, really important to make that connection to yoga. That is a safe form of exercise that we do have studies that concretely show that it can be a way to manage these two particular side effects.
Yeah, that's a great point, Tari. A few years ago, there was a seminal study done out of the University of Pennsylvania called the PAL trial, P-A-L, Physical Activity and Lymphedema. And it was Dr. Schmitz who conducted the research. And she did find that women at risk for lymphedema, meaning they either had lymph node dissection or they'd had radiation, that they were able to undergo a safe weightlifting program, resistance training program, and it would not exacerbate or trigger lymphedema. The caveat here is that the practice needs to start out slowly. So you must start out with very light weights and under strict guidance from the trainer, and you very gently work up week to week. So all of these activities that women were told that they can't do, yes, they can, but they just have to do it in a safe and wise manner. The other thing is if if you go on vacation, say you've worked up and you're at a certain level of your training, if you go on vacation and you don't do anything for a week or 10 days, the recommendation and the guidelines are that you go back and start over and very slowly and carefully work back up.
Well, we hope you go on vacation to do a little exercise.
Yeah, right, right. Yeah. And that study was published in the Journal of New England Medicine and in JAMA. So it's an important study.
There's a similar one, Lee, too, that was done on lymphedema in breast cancer survivors. And the study was yoga versus self-management, which are techniques that are taught to breast cancer survivors post surgeries and post-treatment, how to do a self-lymphatic massage on themselves. And the study, so it was controlled by a group that was doing self-treatment and a group that was doing yoga that was designed specifically to address lymphedema. So there was weight bearing included and all the other things. Well, what it did show at the end of, I think it was 8 weeks, that those doing yoga had a much low, their reduction of their lymphedema. Side effects were definitely reduced compared to the self-treating group. And then, of course, what they did was say goodbye to everybody and came back in 12 weeks and looked at where their lymphedema was after 12 weeks, and which was just, amazing. Those who continued in self-management, there was no change. Those who stopped doing yoga were reversed all the way back. And those who continue doing yoga continue doing better. And so what we're saying here is that there are things about doing very controlled, specific movements of a yoga practice that can address lymphedema. And I did some of them in the video that you have that you're sending out to everybody to just give an idea of some of those kinds of things that can be done in a yoga practice, even if you're on vacation.
Yeah, so Tari produced a really yummy 20-minute yoga practice, which has been uploaded to the YouTube channel for the Society for Integrative Oncology. And I believe it was released about 28 minutes ago. So do go after this, this live session, go and do a 20-minute practice, or it'll be there if you'd like to come back and do it later. The beauty of the practice that Tari did is that it's a very safe practice for really just about any cancer patient. And if you're a clinician, I would invite you to do the practice so that you can understand more of what a safe yoga practice looks like, so you can feel comfortable referring your patients to yoga. Yeah, there are many different kinds of yoga.
Coming back to maybe another aspect to remind is, even with the lymphedema, there is so much the role of mind and stress. Of course, there is physical impact to the lymph nodes or how lymph is processed in the body. But I have personally, working with many breast cancer patients, especially, they can have a surgery, but when even the lymphedema sets in is or can be a factor of stress exposure. Patients who might not have lymphedema in the 6 weeks of radiation or, going back to home to begin a new normal, what we call, and if that transition, if that is stressful, can trigger, or even I have actually seen patients a year, 2 years later post-surgery, this lymphedema flares up, and more than often, there is a very clear exposure of stress. And then again, coming back to the scope of yoga therapy with lymphedema, there is such beautiful alignment of mind, body, breath. So even the mind is addressed if the lymphedema is caused due to stress. So beautifully, both all three aspects of mind, body, breath, and beyond is addressed with yoga practices.
Yeah, that's beautifully expressed. Thank you, Smita. I'm just going to jump in. We have a question. We have 3 questions, actually. Okay. Hello. Do you apply some kind of evaluation or questionnaire before the first session?
Yes, that's actually a very important piece of yoga therapy, and that's what makes yoga therapy different than regular yoga classes, and that we make sure to provide a questionnaire, to ask our clients, our patients, our students questions so that we can understand where have they been, where are they now, what's going on with them, and how can we support them carefully and safely and effectively in their private session or their group class. Yes, a very important question.
Yeah, and to Robin's point, to Robin's point, it's critically important to take an intake and an assessment and a medical history before working with cancer patients, particularly, well, for many reasons, of course, but particularly for lymphedema, because you can have late onset lymphedema. So it doesn't just come on during treatment or right after treatment. It could come up years later when you're back into survivorship. And the patient or the individual who had gone through the treatment might not even associate swelling in an arm or a feeling of heaviness or tightness with lymphedema. So it's really important that a yoga therapist know that this is part of the history, that they may be at risk due to, as we said, the surgery or the radiotherapy treatment, and provide a very careful and wise practice. And I just want to say one thing too, that it's important to be aware of this. This is for cancer patients and for yoga therapists or yoga teachers, to be aware of the early signs of a potential injury or flare-up with lymphedema: swelling, increased muscle soreness, excessive fatigue of the limb, redness, heaviness, tightness, restricted range of motion, and joint pain. And lymphedema there's no cure for lymphedema right now. And they're working on some treatments for it, but there is no cure. It is progressive and it's chronic, and it's life altering for many people. So this is why it's so important to do the intake and to be careful with the practice. That's a great question. Thank you for that. We have another question. In chemotherapy patients, what level of platelets and white cells do you consider a contraindication for the practice of yoga?
I'm going to defer to Robin on that.
I actually defer to the healthcare professional. I think that it's really important to respect the healthcare professional that's taking care of that patient. And so I always have the healthcare professional let that patient know when they feel comfortable allowing them to come into class for risk of potential infection. Lots of times we'll also stream the class live so that someone can practice at home. So that just because you're home doesn't mean that you can't still get to your yoga. You still can't practice your yoga.
Well, in our practice, certainly with low levels of platelets, now I can't give you, I'm not a hematologist, oncologist, I can't tell you what the cutoff is. But as Robin said, the oncologist should always, this is, of course, is for active treatment, people who are in active treatment. They should always get permission from their oncologist before starting any kind of yoga or exercise program. Remember to keep a safe space so you don't, because there'll be, if there is a low platelet count, they're at risk for bruising. So you don't want to have props and things where they may trip or they may hit themselves. Regarding the white count, generally when you're on these various chemotherapies, the nadir or the low point of the white blood cells is 7 to 10 days. It varies per chemo and per individual, of course, but you need to be really careful about the immune system then and the risk of infection. I mean, now with the COVID and the, doing the extraordinary hygiene practices of washing hands and wearing the mask and doing online practices now, things are changing a little bit, but and certainly you would never work with a patient who has a fever, and you would never work with a patient in person if you have any kind of head cold or infection or.
So Lee, I want to jump in here because I totally agree with both you and Robin. Especially if someone is in treatment, that your healthcare professional, your oncologist, should be consulted if someone, whoever is wanting to do either yoga therapy one-on-one in a virtual setting or a yoga class online, that, making sure that those who are in treatment have permission from their doctor. But what I want to make a point of is, especially now in this COVID environment, where people can just sign on and take a yoga class anywhere, anytime, any place from any yoga teacher, and cultivating in the healthcare professional who's going to make a reference or be asked by their patient, can I do yoga? And the point that you made earlier, and which I think is, something we want healthcare professionals to understand, not all yoga is the same. And one recommending a particular kind of yoga to your patient for giving them permission to do, or recommending a particular kind, we need to be careful. We need to be really careful and know what the yoga teacher or the yoga style falls within the category of what we would call oncology yoga, oncology informed yoga, so that teacher, that therapist has been trained to understand, to ask their student who is in treatment, have you talked with your doctor? How are your blood counts? So that's my point, is that not all yoga is the same, and we must be really careful to bring that home to the healthcare professionals.
Yeah, that's a great point, Tari, especially when everyone's gone online. Every yoga professional has gone online with a class trying to be helpful, but we really do need to make sure that the cancer patients are studying with people who have advanced training to know how to safely work with some of the unique challenges of that population. Another question, actually a comment, not a question, that ASCO, the American Society of Clinical Oncology, supported SIO's recommendations for breast cancer, and that was really great. Yeah, it was great. Yeah. For those of you that may not know, the Society for Integrative Oncology did put out a set of guidelines. They were looking at yoga research from, I think it was 1991 through 2015. And so they did a recommendations of integrative therapies for breast cancer patients post-treatment. And it's quite extensive. It goes through not only mind-body practices like yoga and mindfulness and MBSR, but it talks about supplements and acupuncture and other modalities. And it rates them, gives them grades A through D. And the really exciting thing was that ASCO endorsed that. ASCO is sort of the gold standard, well, not sort of, ASCO is the gold standard for clinical oncology. So that was, and you can find that on the SIO website. It's right there on the homepage. Okay, another question. I feel like you're reading from my medical records. Yoga was difficult for me until my best friend became a gentle and yin yoga instructor. Now I can't live without it. If only I had all this info 16 years ago. Thank you, all four of you. Yeah, thank all three of you. Yeah. All right, somebody is raising their hand, and I don't know what that means, because when I click on the hand raise, nothing happens. If you want to just write something in the Q&A, I think I'll be able to see you there. Okay. Anything else about lymphedema or any questions?
Just comment that that our practice in initiating relaxation relaxes our muscles, and that muscular contraction is really important to move the lymph. So it's just another way that yoga helps to get that lymph to nourish and to cleanse our body, simply by doing our yoga practice and decreasing our stress and allowing our muscles to relax.
Yeah.
Lee, I think there is another question, I think, in the chat box. I think the SIO.
Not that I see it. Oh, you're looking in the, I'm in the Q&A. Go into the, sorry. Okay, yeah, here's one in the, sorry, it was in the chat and I wasn't looking there. Silly question, there's no such thing as a silly question. But is there any research or evidence in yoga therapy that tight or stiff muscles impede lymph and blood flow, thus contributing to fatigue? That's a great, I don't know.
I'm not aware of something like that, but I think it doesn't have to be even just within the yoga therapy itself, even rehab or somebody, if they have studied the role of stiff muscles and lymph.
Yeah, actually, I just want to share with everyone that there is, in Australia, there is a certified yoga therapist named Annette Loudon, Loudon. She has a master's degree in yoga and lymphedema. She's done several, numerous studies on yoga and lymphedema, including one that was a randomized controlled trial at RCT. It did have a small sample size. If you're really interested in more about lymphedema, and this particular question, actually, she may be able to answer it. You can Google her and find her online. She's quite interesting. And in one of the, actually right before I came in, I downloaded one of her research studies, and she actually gives a whole protocol working with lymphedema. If anybody wants me, I can't put it in the chat, a link to give it to you, but if you give us your email, we'll send it to you after the webinar.
So Lee, I want to, unless there's another question coming up, I want to make a point on that has not come up in our discussion so far, and that is, who are those that are more at risk for developing lymphedema? And I think it's really important, and it connects into the conversation in and around exercise. Yes. And that those more at risk are those who are more likely to be carrying weight.
Yes.
And I think that whereas someone who's had lymph nodes removed and they're not carrying weight are going to feel more comfortable doing yoga postures. Someone who is carrying weight is probably going to have, and back to the point that the question about flexing muscles and muscle tightness, and that even though we don't have any concrete research that we're pointing at that's going to say a stretched muscle is going to help irrigate the lymph system better than not flexing the muscle. There's no concrete evidence to that at this point. But What we do know is that people of weight are less likely to be encouraged to do yoga. So what we want to do is to bring them a kind of yoga that is going to be accessible to them, that is going to be safe, and will put them in an environment with a knowledgeable teacher who will know how to make it accessible and comfortable. Because what I think everything that we've said so far, whether it's lymphedema or it's fatigue, that movement is medicine. Movement is the source of keeping the American Cancer Society says it, that we have to keep the body moving. And with weight, it's another obstacle.
Yeah, that's, thank you for bringing that up, Tari. One of the risk factors for lymphedema indeed is overweight. And I think it's a BMI greater than 25 actually increased the risk for lymphedema. Just another reason why exercise and yoga is such an important part of holistic care for cancer patients and survivors. I just wanted to make one more point about the lymphedema, and then we'll move on to, with what time we have left, we'll move on to do a quick osteoporosis. It's such a rich conversation that, you know, we think we can get all these topics in within 45 minutes, and we're just, we're very ambitious. So compression garments, you may have heard or you may know that people with lymphedema are often prescribed a compression garment. Now, if their healthcare provider has prescribed that, then follow the guidance of that professional, whether or not they should be wearing that during exercise and during yoga. And generally, what I've read in many of the studies is the advice is to wear the compression garment if you have one. If you do not have a diagnosis of lymphedema, but you are at risk, there is some controversy over whether or not you should be wearing compression during exercise. And again, defer to your licensed healthcare professional on that. That's not a yoga therapy, decision to make. But yoga therapists should always work closely with licensed lymphedema specialist to make sure that the care is coordinated. Exercise and weight-bearing activities are cumulative. So you have to consider that if you're doing yoga with a patient or a client, you have to know what else they're doing on the other days, because all of this is cumulative and you don't want to overtax the limb or the body. So that's important. Okay, let's quickly, we're supposed to be finished now. It's 12:45. If anybody needs to jump off, please do so, and we'll have the recording. I think, are you all okay to keep going for a few more minutes? I know, Smita, you have a meditation you have to teach. Just jump off when you need to.
Lovely. I just wanted to maybe make a comment in terms of the platelet counts and the white cell counts and others. In our previous conferences at MD Anderson and working actually as part of an integrative medicine team, there are very clear guidelines, say for example, for when to start or stop acupuncture if you have a certain count. Mm-hmm. The same for massage therapy,
yeah, sure,
meditation and movement. But with yoga, again, year and time again, when we have presented and organized these discussions, the idea is the practices are so many. The tools of yoga therapy may be gentle movement, breathing, meditation. All these are tools of yoga therapy. And to kind of like just say, oh, if you have a certain count, don't do any yoga, won't fit in. So definitely the guidance, as Tari and Robin has mentioned, the guidance and expert involvement from their own oncologist and the therapist who is working with them will go a long way to coordinate care and devise a safe practice for the patient.
Yeah, it's all about teamwork, working together, collaboration, allied healthcare. Yeah. Let's jump quickly to osteoporosis. I just want to read a couple of bullets sort of as we transition. Many times, patients who have lymphedema can also have osteoporosis. So they appear together, particularly in postmenopausal breast cancer survivors who are taking aromatase inhibitors. And generally the prescription for that is 5 to 10 years, and have also had breast cancer surgery or radiation therapy. So you might see a client or a patient who has both conditions, lymphedema and osteoporosis. So you always have to think about bone health as you put them through movements in order to move lymph through the system. Second thing, men can have osteoporosis and lymphedema. And I just want to point that out because sometimes people are surprised. They're like, how can a man have osteoporosis and hot flashes? But prostate cancer and testicular cancer, if they are prescribed androgen therapy, then they're going to have very similar side effects as a postmenopausal woman with an increased risk of osteoporosis. And in that case, there would be a lower limb risk for lymphedema because the surgery or the radiation was in the pelvic and inguinal area. Women, just want to say another thing, that women with gynecological cancer can also be at risk of both conditions, osteoporosis and lymphedema. Some gynecological cancers are treated with hormone therapy, which would cause, contribute toward osteoporosis, and also the same lymph node removal in the abdominal area. And just, I'm going to put one more point because this is kind of a pet peeve of mine. There's a difference between aromatase inhibitors and tamoxifen. So aromatase inhibitors, they're both hormonal therapy, but they have different mechanisms of action. And the aromatase inhibitors are prescribed for postmenopausal women, and they contribute to bone loss. Whereas tamoxifen, a different kind of drug, is prescribed to premenopausal breast cancer patients, and also sometimes is prevention. And tamoxifen is known to help preserve bone strength. So I just had to get my little thing in there. But okay, with the remaining minute we have left, osteoporosis.
Share that that we talked a lot about the compressive forces, which are the weight-bearing exercises which strengthen bones. But for anyone out there that is concerned that they can't do those exercises, tensile forces are really important in strengthening bones as well. The tensile forces being our muscles lengthening and our tendons that connect muscle to bones or tug on the end of the bones where our bone grows, stimulating them to grow. And so we can be sitting in a chair and we can be moving our bodies ever so gently and still stimulate bone growth. And Dr. Lauren Fisherman's done a lot of work in this area in New York, showing that yoga increases bone density by measuring DEXA scans. So I just want to encourage anyone who's concerned about not being able to do weight-bearing exercises that they can absolutely have an effect on their bone growth and their bone strength simply by doing yoga.
Anybody jump in?
Well, I just want to say one thing about your comment about men get it too.
Yeah, that's a poor choice of words. Men get it too. But,
because I think that one of the things that's overlooked in cancer in general, men get it too, but is that, you know, we're all on this path of getting old. And whether you are receiving chemotherapy or hormone therapy, we are all losing bone. We are all subject to this by the disease called aging.
Yeah.
And it's another reason for men and women to consider it, even if they are of size or they are not able to function because they have some other contributing factor of, arthritis, a hip replacement, or, coronary disease. There's so many reasons to not move, and there's so many excuses that one can find. And no matter what, we are all aging, and we need to keep moving to keep our bones strong, to keep our lymph moving, and to, to avoid all, complications from all of these things, which comes with living. So that's all I wanted to say, that men get it too. And we all get old. So whether you're on chemotherapy or medication for heart disease, we are all getting old.
Adding to what Robin mentioned about the osteoporosis part of the conversation, I think especially patients with metastatic cancer, being really careful. Whenever I hear osteoporosis, it just brings a little more awareness to safety and precautions than even others so more, especially because a lot of times cancer patients themselves may not be aware of bone mets, and putting them in extreme postures, again, can be very dangerous. And of course, a trained yoga therapist would know the modifications and the practices that would be appropriate for different populations.
Yeah, I love what Tari said about we need to move, and I love what Smita said about we have to be careful with some of the movements. I had wanted to put a slide up that I wasn't able to get up. I'm just going to read it to you. So when we're looking at the cancer population, we're talking about, and this is people in active treatment, this is complex osteoporosis, metastases to the bones, radiation therapy. These are causes and contributors to osteoporosis. The aromatase inhibitors for women and androgen deprivation therapy in men, steroids. Steroids, are common in cancer care, and they do lead to osteoporosis if it's a high dose and long-term use. Multiple myeloma is one of the cancers that affects the bones. Some chemotherapies, either direct or indirect. Indirect would be ovarian suppression, which then you get the whole, estrogen deprivation. And some of the chemotherapies work specifically on the bones, affect the bones. Like Tari said, aging, and one of the greatest risk factors for cancer is getting older. And so as part and parcel of getting older, there's osteoporosis. Smoking. If you smoke, that's contributing to osteoporosis. Osteoporosis, and this is another really important thing, that it can reduce your functional ability and your quality of life, and it can lead to depression and a greater fall risk. So these are all things that when we're working with cancer patients that we take care with to make sure that they can move the body, which is so important, but they can do it in a very safe way. So thank you both for mentioning that.
Thank you, Lee. I will jump off.
Okay. Yeah. Thank you, Smita. Well, now we're an hour. Should we jump off? We still have 30 people on the call. What do you think? What do you think? So I'm going to ask the audience, if you have any more questions, please go ahead and put them in, and we will we'll get ready to wrap up and sign off. Okay, hold on. Let me get back into this. Bear with me. I don't have my glasses on. We have 2 questions. Do we have time for them? What do you think? Or should we just say thank you?
Sure.
Yeah. So we have a question about, and this is from someone we know and love. How much do you think cost is a barrier to participation in yoga for people with cancer? How are most people paying for classes?
Well, I'll jump in on that. I mean, there's the paying for classes, and then there is also paying for therapy. I would want to draw a distinction between those two, and we certainly would not pay our therapist, whether it is psychotherapy or physical therapy. That that is just understood. I think that that is the respected professional position. And classes, there are multiple classes, and especially now in our COVID era, that are free online. And so cost is not going to be an issue there. But I would say that there is definitely a financial toxicity that comes with cancer, which is another reason why we want to have yoga therapy taken seriously, looked at, lots of research being done, and embraced by the healthcare world, the healthcare professionals, so that we can become subsidized and funded by insurance coverage, because no therapist, for whatever product they are delivering, whether it's acupuncture or yoga or physical therapy, should be treated as a professional and should be paid, and that should come under any kind of insurance policy. That's our hope, that's our goal, and I would hope that that is in our future.
I love that goal. It's amazing. Anyone out there who is on the cancer journey, or any clinicians who have patients who are, as Tari said, there are lots of free classes out there. My classes, group classes, are free or donation-based. Private yoga therapy is fee-based, so we try to make everything make it all accessible to anyone. So there's no reason why you wouldn't be able to take advantage of the healing benefits of these practices.
Yeah, so of course, there's inequity in healthcare, right? And we actually are going to have a panel discussion with a yoga therapist and an oncologist talking about the inequity in healthcare specific to the Black community. And that will be, I think it's July the 15th. So we'll continue this discussion about how to make yoga therapy and other integrative therapies available to all people, regardless of ability to pay or not, because it's good stuff. There's one more question. Sleep disturbance in yoga.
Well, we certainly are not going to make the point that yoga disturbs your sleep.
Do they mean improving sleep with yoga?
Please say something about sleep disturbance and yoga.
Well, that's a whole other.
That's a whole nother hour.
That's a whole other conversation. The short of it is that many individuals who practice yoga improve their sleep, both the ability to fall asleep and stay asleep. But stay tuned, Lee, we might have a whole other discussion on that.
Yeah, and I will, for the person that wrote that question, thank you, that's a great question. There are some very strong research studies on yoga and sleep, and I'm sorry, I'm drawing a blank right now. I should be able to quote it off the top of my head. I believe it's coming out of the University of Rochester. YOCAP, does that ring a bell with either of you? Can you
Well, there are lots of studies on
There,
sleep
there, there are a
related.
lot of
You
studies.
know, I wouldn't single it out to any one, but I think that there are many really good ones. And you know, in addition to you know, what are the causes of sleep disruption? Um, you know, we're clustered causes. So certainly, I think of yoga as, for myself, I always do a practice late in the day, and I kind of consider it like doing my laundry. You know, you go through the day and you get stuff dirty, you get knots in your back, your wherever going through the day. And when I do my yoga practice, I feel like I've taken my clothes through the laundromat, taken them out, and then neatly folded them. And that's how my body feels after a yoga practice. I mean, the goal is that feeling of well-being. And when, you know, you go to bed in a bed that has clean folded sheets, has anybody done a study on that? You know, do you sleep better on clean folded sheets
I
than
do.
on not? So I would say that there's plenty of evidence out there, many studies on men and women, and it shows that definitely there is a connection to a better sleep. Certainly the breathing techniques for those who are counting sheep, counting it with your breath is, you know, a classic way to manage some of those sleep disturbances, which are so common in cancer care.
Yeah, yeah. And for any clinicians or physicians who are out there, the study I'm trying to remember was in the published in the Journal of Clinical Oncology, a very strong RCT. So yeah, tell your patients to do yoga to get a good night's sleep. So wow, we could just keep going forever. We had a lot of information. We were very ambitious. We got a lot covered. I thank you so much for joining us, Tari and Robin. Really a terrific hour together. Thank everyone in the audience. We still amazingly have a large group of people still hanging on. We really appreciate you tuning in. Hope that you will continue to join us every Wednesday at 12 o'clock through Labor Day. We'll have many more sessions on yoga, as well as different mind-body practices, including we have a Native American healing meditation. It's going to be a live performance, a donation base to raise money for Navajo Nation. Their hospitals in Tuba City, the reservation in Arizona. The hospital is wiped out of PPE and hand sanitizer. So we're hoping to, through SIO, raise money to send them much needed supplies. So again, go do some yoga. Go find Tari's video on the YouTube channel. Just go to YouTube, search Society for Integrative Oncology, and you'll see her there. So
thank you for inviting me, Lee, and thank you for putting together this series.
yeah, did it
Thank
best, you guys. Okay, bye.